We are going to see the important topic in again unit 2, that is impedance plethysmography. So the learning objective of today class, which includes what is the empathy perspective of this topic and working principles of impedance plethysmography and its technical configuration, measurement parameters, and finally we will end up with application and pros and cons of using this impedance plethysmography. So before getting into this topic, first we will see what is the problem, what is the need, or what is the empathy, empathy point of this particular topic. So the reason is that there are so many techniques, traditional methods are there, which are invasive method to measure the blood flow techniques, blood flow. So that may cause the patient to feel discomfort, or they may not afford to have this such a traditional expensive non-invasive technique to have their blood flow measurement. So that is the reason they have given a problem statement like there is a need of doing non-invasive blood flow measurement techniques to record the blood flow parameters of the patient to have a different identification of disease based on the blood flow. So as a solution, they have brought up the one such technique called impedance plethysmographic technique, which is one kind of non-invasive technique, which is mainly used to measure the blood volume changes through the electrical impedance. That is the reason they have given the name called impedance plethysmography. So the importance of using this such impedance plethysmography technique to measure the blood flow measurement is that to identify any kind of cardiovascular diagnosis or monitoring or enabling continuous real-time monitoring of blood flow. So now let's move on to the what is all about impedance plethysmography and how does it works, what is the working principle of this impedance plethysmography. So impedance plethysmography, as I said already, the impedance is nothing but it's a resistance, right? So plethysmography, it's mean like it is the measurement of blood volume changes. So plethysmography is nothing but it terms refers the blood volume changes. So the blood volume changes here we are going to measure by means of impedance. That is the reason the word is called impedance plethysmography. So this is one kind of non-invasive technique. We are not going to take any puncture, or we are going to take a puncture of your blood vessels, or we are not going to have any direct contact with your blood vessels by means of using catheter and so on. So how does it works? What is the relationship of blood and impedance? Right. So if you see the impedance, already you know what is meant by impedance. It is a sort of resistance, right? So how it's being interlinked with blood in the sense the blood usually have the low impedance. The reason is that it has a very high electrolyte content. That's why it's behave like a conductor. Okay. So already we know that conductor and resistance are inversely proportional. When you have a conductor mode, there is the flow of electrons will be very lessly restricted, right? So that is the reason when you have a very good volume of blood, obviously because it has the property of conductivity, it has a very low resistance over there. That is the beautiful relationship between blood and impedance. So from this, how we are going to measure the volume by means of impedance? Then we have to know what is the volume impedance relationship. So if we have the more volume of blood, okay, already you know the blood is a very good conductor. Obviously the resistance is very low. Again, if you have the increasing volume of blood, obviously you have a decreased electrical impedance. In this way, we are going to connect the volume and the impedance. So these are the two relationship. If you get to know these two relationship, then it is very easy to know what is the impedance plethysmography and how does it works. So this change in impedance is clearly reflects the what is the blood volume variations, because we know that at each and every heartbeat, whenever it's pumped out, you can see the atrial pulsation, right? That you can feel it on your wrist or so many points. So that feeling, that sensation of pulsatility is because of what? The contraction relaxation of your blood vessels by means of each and every, as a result of each and every pump out of your heart. Okay, it indirectly speaks your diastole and systole of your, that is a contraction relaxation of your heart. Okay, so now we move on to what are the methods, like here we are using 4 electrode methods. The 4 electrode, out of this 2 electrode we are going to use as a outside. So through this we are going to apply some AC current. Okay, and second one is 2 inner electrodes. By means of that we are going to measure the voltage drop. Why AC current, why voltage drop? Here you may have a question. So as name suggests, the impedance that we are going to use, you going to measure here, that is a resistance. So because the blood volume changes, we are going to measure by means of this impedance resistance. Then how we will measure this resistance? By means of Ohm's law, that we know that P is equal to IR. So if R is unknown, means then remaining two, that is the voltage and current, that we have to fix it, right? So what we are doing here, we are going to apply the constant current. Here the resistance is nothing but your blood vessels. Okay, so here the resistance is nothing but your skin or your blood vessels. So that is unknown, that we have to measure. So for that we are going to apply the constant current over the skin, that is over the resistance. So whenever the current passes through the resistance, you can see the voltage drop. So the recording of that voltage drop is directly proportional to the change in resistance. How it's happening? This change in resistance reflecting the change in blood volume. So this is how we are measuring the blood volume changes. So simple concept of Ohm's law. Okay, so next we have the technical aspects, like what type of source we are using, what type of amplifications, and what is the output we will get here. That is a baseline output and venous blood volume changes you can get, and finally you have the atrial pulse wave, that is very important. So these are the parameters we will measure. PA is the amplitude of pulse wave, and the ratio PQ is the ratio of systolic and diastolic part, and PT is the R peak in ECG waveform. CT is the time delay between the point of slope, rise and onset and maximum of the curve, and the last one is like width. CW is the width. So this is how we can see the waveform in the display. By means of that we can easily identify how the volume is changing at each and every heartbeat. And then finally we have the application. So it's very important to measure the stroke volume and cardiac output, and we can have monitor what is the functionality of the heart. And also we can record the hypodynamic parameters like blood flow dynamics. So especially we can use it in patient monitoring during surgery, and which helps to guide the fluid management medication, especially in the critical care, and or giving any anesthesia for the patient. So and also we have vascular diagnosis, like few are listed here: venous thrombosis reduction, peripheral atrial, this is venous insufficiency assessment, we can do it, and segmental pressure measurements also we can do it. So finally we have advantage and limitation. So advantage, this is one kind of non-invasive and continuous monitoring, non-radiation exposure, and it is easily affordable to all the people to have this such technique to measure the blood volume, and portable and safe for long-term monitoring. But limitation is this more rely on electrode placement, because by means of electrode only you are going to measure. So then in that case we have to very careful when selecting the electrodes, a limited spatial resolution, and it is very vulnerable to the artifacts. Tissue complications will also have very good impact on accuracy, and a limited depth of measurement. Finally, temperature also influence the output. So these are the assessment question related to this topic. You can go through that in later part. So finally, we have come at the end of the section, right? Summary. So this is the overall picture of that what we have discussed so far. What is impedance lithosmography principle, technical configuration, what are the different measurement parameters we can do it, and finally application and limitation. Thank you.